Hi, I'm Dr. Dow, and we're in our examination room here again. And what I want to explain is how acupuncture helps with pain. And myself, I have 2 degrees. I've got a doctorate in chiropractic, and I also have the equivalent of a master's degree in acupuncture. So you may be have tried dry needling. Just so you know, most of the people that are doing that might have 50 hours of training, 100 hours of training, maybe even 300 hours of training. Even some of the medical doctors, maybe 300 hours of training. To be an acupuncturist as a chiropractor, I have about 3,200 hours of training in acupuncture. So there's a whole nother world of information out there. For example, if you do points on the top of the shoulder, that brings energy downward. A dry needling doctor might do that and bring energy downward, but that person might not have enough energy in their head and actually could make the symptoms worse because they don't understand how that effect is actually happening. Now, if they have too much energy in the upper body, doing those points is perfectly going to be helpful, but might not be the best thing for if you don't have enough energy. But I just want to give you an idea of there's so much more out there about that. But I'm also a chiropractor. So what we find is when people have bones in their spine or in their joints that shift out of place, that'll start putting pressure on the nerves, and that's usually where the pain's coming from, is that pressure on the nerve. And what happens is that energy that goes through the nerve will pour out into the tissue. It'll build up pressure, sort of like energy in a bubble. And what we're doing with the acupuncture is we're taking the needle, it's like popping that energy bubble and letting the energy escape. Now, what acupuncture does and doesn't do, first off, it doesn't get the pressure off the nerve. It doesn't, like when we put the needle in and we take it out, the bones didn't move. We didn't get the pressure off the nerve. It doesn't keep the pressure off the nerve. So your posture is what's going to really help to keep the pressure off the nerve. And if you start to slouch, like if we do acupuncture, you get off the table and you start doing this, that means that bone is shifting back out of place and the pressure is going back on the nerve. But if you have a leaky roof in your house and the basement is filling up with water and the drain is clogged, what the acupuncture does is it gets the clog out of the drain, lets all that water come out of the basement. But it doesn't fix the leak in the roof. So we want to do chiropractic for that, get the pressure off the nerve, keep the pressure off the nerve. But if that basement is full of water, then we can do the acupuncture to get the drain open, so that can help you feel a lot better too. But what I find is that the chiropractic and the acupuncture work really well together to get those 2 situations cleared up. And you want to make sure you find a doctor that understands both of those principles that can really help you to fix that. But that's how acupuncture is going to help with the pain. And if you get that sensation in your body where you can feel that pressure that's in there, then acupuncture can really good to let that out of there. But at the same time, if those bones are shifted out of place, putting pressure on the nerve, because it probably is, then we want to get that adjusted to get the pressure off the nerves. And then we want to do things to keep the pressure off the nerves. So stay tuned for more videos about getting the pressure off the nerves, keeping the pressure off the nerves, and even more about how acupuncture can help. Thank you very much.